Hi, everyone. I'm Victoria Valdez. I am a licensed marriage and family therapist who specializes working with kids, teens, and women and parents in the state of Tennessee. And today, in honor of Latinx Heritage Month, which starts September 15th through October 15th, I'm spotlighting some local Tennessee Latinx therapists. And today I have Dr. Mendez, clinical psychologist. So welcome to have you here today. And
Hi,
so,
thank you for having me.
is it okay, Dr. Mendez, if I call you Amanda?
Yes. Yeah, of
Okay,
course. You can call me
awesome.
Amanda. Yeah, we work together and collaborate, so that works for us, right?
Yes, awesome. Thank you so much. So tell us a little bit about yourself, your credentials, and anything else you'd like to share with us.
Oh, well, thank you. So, yeah, as you said, Dr. Amanda Mendez, but I always tell my patients and my families, you can call me Amanda, you can call me Dr. Amanda, you can call me Dr. Mendez, whatever flows off the tongue, because I really want them to, feel safe and comfortable. But yeah, I'm originally from California, so I've actually lived here in Nashville for just about 1 year now. And I went to school out in California and trained out there. So went to school at Loma Linda University, which is a health sciences institution, but also, has it's has a kind of like a religious background. So they are a Christ-centered university. So I always let my families know that I'm very comfortable integrating spirituality into your care, but it's certainly not a one size fits all. And I am not a spiritual, faith-based counselor. I think that's like a whole category here in Nashville, or in Tennessee, which, to be quite honest, it's not as common in California. So I've learned a lot of things here, moving here, that if I say I'm a Christian, or if I say I have a background in, spiritual practices, people kind of jump to, oh, are you faith-based counselor? And that's like a whole category in itself. So I just like to clarify that for my families, is that I am very comfortable incorporating that, because I do believe that it is a part of culture, right?
Mhm.
And I want to consider all parts of someone's culture. So if that's their desire, I'm happy to do that. It doesn't have to be Christianity or any of the like Catholicism or anything, the Western religions. It could be any religion that they're comfortable or that they prescribe to. So that's something I like to talk about with families, just to see if it's part of their culture that they'd like to bring up in treatment. But yeah, I am married. I have a husband who's very supportive of me, and he's in the healthcare field, but kind of like, we joke that I'm on the front lines and he's in the backstage does the work that people don't think about in terms of you know quality and documentation and all that. So, and then
Yeah.
I do have my animals, my fur babies. So I have a German Shepherd and I have two cats, and we live right on the river in Nashville, so we love the outdoors and we
Beautiful.
love to be active. Yeah, so we're loving it here. We're really happy to have made the move from California.
Awesome. And I love how you highlighted, Dr. Amanda, just about like the difference in California and learning the culture here in Nashville, right? And the
Hmm.
clinical culture, right? And just the other cultures here that are here. So I love that you also bring spirituality into the therapy room if they want to. And I love that idea of the space of, hey, spirituality, what it is for you, right? Not just westernized beliefs, right?
Yeah,
Um,
absolutely.
I love that. I'm so glad that you're doing that. So Dr. Amanda, tell us, how do you help people in your profession?
Well, I really do specialize working with children and adolescents and families, so that's been the majority of my training. And so I do love to work with these kiddos who are just at these early stages of, their social learning and going into school and kind of navigating that transition. And so, what I like to do is make sure that families understand developmentally where their child is at, and just understanding the expectations of, I think with generation gaps, like how we were even raised. And then if I'm working with parents who are even a little bit older than myself, how they were raised, or anything like that, it's much different now in terms of expectations. And so I feel like helping parents and children too, if they're old enough to understand what is developmentally appropriate right now in terms of behaviors, learning, emotional intelligence, and the ability to regulate. So I think education is a big part of how I help people. And then when they come into my office, say they decide to pursue treatment with me, whether that's therapy, I also provide psych assessments. So I'll talk a little bit about that. But I really try and make sure that I hear what their main concerns are. Of course, the parents typically have one type of concern and the kiddo or the teen has another type. So I try and listen to both of those and see where we can blend them. They're usually related, just, not always using the same language.
That's
And
exactly what
so
I was thinking, right? Just a little bit different the way they say it, right?
yeah, yes, absolutely. And that's always a fun puzzle to put together. So really making sure they understand this will be an individualized treatment plan, and letting them know that although I do have orientations, like theoretical orientations, a fancy word to saying what I like to practice from is like cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, or acceptance and commitment therapy, which is ACT. And even though I like to practice from those theoretical orientations, the way that I can adapt them is very individual, and it's going to be tailored to their needs and concerns. So therapies, so education, therapy, and then with the psych assessments, like I mentioned, that is something that we will do. It's different from like a neuropsychological assessment where they're looking at a lot of the cognitive functioning and where you might have deficits or difficulties in certain brain functions. It's actually more of a psychological assessment looking at personality, mood, anxiety, other behavioral challenges, and trying to see if there's some answers we can provide the family that can really give a direction to what type of treatment to pursue. And it's really helpful a lot of times for other providers, like if they are going to pursue treatment in a different community or in a different setting, the provider can read that report and understand the data that's included in it and say, oh, okay, so say there's some budding personality traits, they would understand what would work better with that type of temperament and personality characteristics versus maybe we'll just say typically developing or super sociable and outgoing teen. So it's just a different type of assessment, but it does look at important factors that parents can have a lot of concerns about with their teen, their adolescent who's going through this really important developmental stage, and hormones and social situations and everything can kind of trigger a lot of changes. And so if there's the psychological basis to what's happening, we like to kind of figure that out and help them know what could be happening.
Sure. I feel like it gives kind of like a bridging of understanding of the behavior by trying to understand psychologically the personality type or what else are factors. And I feel like that's giving you as a clinician more of a roadmap, right? Like as a snapshot. Okay. And would you say, for examples for psychological testing, the first thing that popped in my head, Dr. Amanda, so correct me if I'm wrong, I was thinking of like the MMPI or the Edinburgh, or maybe not.
Yeah, no, you're absolutely right. So we would use the MMPI-A, which is the adolescent version, because I don't do assessments for adults at this point in time. So it's basically 17 or younger. And then there's also the PAIA, which is another personality assessment. And then we do, I'm sure you're familiar with like the BASC and the brief and other type of like emotional, behavioral, and also executive functioning assessments, and seeing how those factors are. And we also do oftentimes, particularly if the teen and the parents are having a difficult time getting along, we do parent-child relationship questionnaires, and just seeing, like you said, it's like a roadmap. So seeing not only like clinical interventions that need to take place, but what can be changed in the home, like what can be changed in their everyday life that will really make a difference. And sometimes that is really helpful for parents to gain an additional perspective, or just like a little bit of a shift in their perspective, which helps the whole family feel a little bit more at peace. So those assessments you mentioned are right up our alley in terms of compiling it all into a psychological assessment.
I have to do my plug on systems there. As you were
Mm,
talking, my systems training of marriage and
yeah.
family, right? That family component of, I love hearing you like looking at, hey, how can the family system change, right? Like what can the parents, the relationships, those subsystems, how can they work together more effectively, or where's there, a better maladaptive behaviors there, and how can we bring those forth, right? So I love that you're guide that, like, that's what you're doing, and it's a big picture versus just the individual, right? When working with
Absolutely.
children.
And yeah, and to that point, when I often tell parents, even if if they have a two-parent home, but not both parents can participate in treatment, I often tell parents, believe it or not, when there is a system, right, and one person changes, that's going to help everyone
Hmm.
change. And that's kind of what we saw happen in maybe the, if you want to say, like, more negative realm, in terms of, like, if a child starts acting up, that affects everyone. So
Right.
if, let's just say, dad can only participate because, mom works full time, or whatever the situation might be, that's still going to make a really big change in mom and kiddo. So I always encourage families in that way, and I think that's an important thing to remember, that it doesn't have to be everyone on board, although that would be ideal.
Right.
It's going to
In the
make a
perfect world.
difference.
Right, but
Yeah, I
right, no, I
know.
love that, right? How you can change that second order just by the second order of change just by implementing
Mm,
changes in the first, right, in that first,
hmm.
like you said, right? So I love that. I love that.
Great.
I feel like you gave such a great answer that I was like, oh man, we answered several questions like in one punch, and I love that. I loved that.
Cool.
So tell me, what do you just a couple, like, what would you, since you specialize working with adolescents and children, like, what are a few of the things that come to mind that you notice the most mental health issues or struggles in those populations that pop up the most? Give me a couple of them.
Hmm. Yeah, so the interesting thing, Victoria, and I'm sure that you've experienced this too, because I think you have similar background in terms of training and where we've worked. Where you work does make a difference as to what you see clinically in your patient population. So a
Mhm.
lot of my training and past experience was done in community mental health, which is working with the county systems of care. So working with foster kids and working with families who are struggling and need additional assistance, whether that's financial or educational or just social support. There's a lot of risk factors in those communities. And so
Right.
in that population, there's a lot more trauma. There's a lot more of the, you kind of mentioned the family systems work in terms of like the neglect and just trying to help parents feel very equipped to take on this like super difficult journey of, parenting a kiddo who may have had trauma and is having a lot of emotional outbursts that is
Right.
disruptive to the whole family. And they don't understand why, because they're trying their best to provide this nurturing
Mhm.
environment now that they're, together or whatever the case was. And so I would say I'm very familiar with seeing a lot of complex trauma in children in those types of systems of care. Not all kids who come through county systems of care have that, but I'm very familiar with that. I think in more of a private practice realm, you typically, although obviously it still exists, you typically see less of that because um, what I'm seeing more of is a lot of anxiety and a lot of ADHD, attention deficit hyperactivity disorder. I work with a lot of kiddos who are on the spectrum, and I think with the recent, with the I guess discoveries and research that's coming about with this, the spectrum, is that kiddos can like be on the spectrum but not have a clinical diagnosis of autism. So I think what we're seeing there in the term is neurodiversity.
Mhm.
So there's just a lot of maybe behaviors or symptoms, if you want to call it, that make it difficult for them in a daily functioning space. But it's not enough to meet criteria
Mhm.
to give it a hard, fast label of autism. So those kiddos where we call it neurodiversity, they struggle with executive functioning skills, and that's like that organization, planning, impulse control, flexibility. And those are things that if your kiddo is what we might call neurotypical, which, just like I always try and do air quotes because some people are more comfortable with these terms than others. It's not bad, it just is. And so if you have a
Right.
kiddo who's more, yeah, yeah. And if you have a kiddo who's more neurotypical, those skills might come a lot more naturally just by watching adults, watching their peers, being in the school system, being social, and other kids who have a lot more neurodiversity, it just takes longer for them to pick up on that, and it might
Right.
take some more intentional training, executive functioning training, executive functioning skills training. So I work a lot with that, and I work a lot with kiddos who do have a lot of resources in terms of their social support, and quite frankly, even their socioeconomic support, and maybe even like IQ level. Those are all what we would call protective factors,
Right.
and they struggle in other ways in terms of maybe some mood or anxiety or executive functioning deficits.
Yeah. I love how you made the clarification of just like different populations or where you work, right? Might have different, needs pop up, right? Because that's real, right? Like
Yeah.
so I like how you touched on that. So something that I forgot to mention is that you're bilingual. So we both
Oh,
of us
yeah.
are bilingual. We speak Spanish. So I was
Same.
like, hello. I forgot to
Yo hablo
add that in there.
español.
So
Sí.
I love that. I love that you speak Spanish. That's such a huge, great resource. We have, a
Gracias.
budding population of Latino speakers, Spanish speakers here in Middle Tennessee. And so having access to someone who can speak Spanish rather than, it's nice to have a translator, but it's not the same when you
Mhm.
have someone who can speak the language with you. So I love that. I
Yeah.
wanted to make sure I plug that in. So kind of leading to my next question is that since you have the ability to speak in Spanish and work with Latinos who speak Spanish predominantly, right?
Mhm.
What are some things when you're working with the Latinx community, whether they're exclusively Spanish speakers or they're bilingual themselves? What are some important factors to consider when you're working with them culturally and even culturally diverse families, but specifically the Latinx community?
Mhm. Yeah, it's a great question. I think in my experience, when I work with families who are culturally diverse and perhaps bilingual, um, in a lot of my cases, the parents would be monolingual Spanish speakers, and the children would be bilingual. And there's a huge dynamic of just making sure that you are getting a grasp or getting a grip of what is happening in the home in terms of not assuming that parents can speak both English and Spanish,
Mhm.
not assuming that the child's even comfortable speaking both Spanish and English. Um, sometimes the kiddos' first language will be Spanish, but by the time they go to school, they're speaking predominantly English. And I think the acculturation factor, did I say that
Mhm.
right?
Yeah.
How much they've acculturated or assimilated is a big thing to consider because, again, you don't want to make assumptions that because the kid is speaking English, that this family is completely acculturated or assimilated. You want to really respect where they're at, and if that's a
Yeah.
conscious choice or if there's any barriers that's preventing them from accessing the things that would help them. Let's say, I know there's a difference between acculturation and assimilation, but let's say they do want to, you might need to help me out here, and this is really important actually to be aware of these differences, but maybe they want to assimilate, but they don't want to fully acculturate, which means they're not going to
Right.
give up their culture for like the predominant culture where they're living, but they would like to be able to navigate the community and be a
Right.
contributing person in their community who represents a different culture. So I think that these factors are important to get a grip on and kind of investigate when you're meeting with the family. Like, what are some practices that you guys really value and hold dear in your home, and what are some practices that maybe you've had to give up, and just kind of
Yeah.
really being empathetic to their place in, like you said, Middle Tennessee, right? This is not where I came from, Southern California. There was just a lot more room, let's say, for Latinx families, and it wasn't. I guess the population was greater there, right? And
Right.
so, although you said there's a budding community here, I think that you still want to be aware of that, of how they're feeling in this
Mhm.
space, and if there has been room for them to bring their culture and honor their culture, or if they're feeling a little bit more reserved in that way, and giving them room to be who they are in your therapy room.
I
So,
love that. You said that so beautiful. And I also love too, just like bringing into the space, like, how is it for them being here, right? How are they adjusting? How are they, like you said, the degrees of, I like to call it, like, are they, are the children first generation? Are they, right? Like, how are they, what are their family role, like beliefs on, like you said, assimilating or not, or how much, right? Like, and letting them know, right? You're bringing that as a safe topic. Like, yeah, you can talk about that in here. We can
yeah.
figure that out. Something else too that when you were talking, made me think about when I work with, the Latinx community too. Like, not, you have the Latinx community is so diverse, right? We have people that are born in the country from are first, second, third generation, but are from different Latin American countries, right? And then you
Yes.
have people who are first generation, or they have recently migrated or immigrated from different Latin countries, right? And I know I found, kind of bringing into the room, and the oh my gosh, Dr. Amanda, you might have to help me. The word is slipping, but the idea of the generation aspect of, like, my parent grew up in this Latin American country, and now I'm
Yeah.
here, and there's like this gap of understanding. How do we, the frustration parents might have of my child being born in this being raised in this culture, and I have
Yeah.
this other culture belief. I can't think of the fancy term, but
Yeah,
bringing that in the
I do
space.
know what you're talking about. And it'll come to us probably when we hang up.
Yeah.
But yeah, but it's that rejection, right, of the kiddo who just really wants. Kids want to be like every other kid, and it's
Right.
funny because when you grow up, you learn to embrace your differences. Like,
Mhm.
you can't tell on camera, but I'm petite, and when I was growing up, I hated, like, a part of me hated it, part of me loved it because I could hide places and get away with things that older kids couldn't, but part of me hated it. I was like, I want to be 5'10". I want these long
Yes.
legs. And then it wasn't until, I got to be maybe older teen or young adult that I was like, this is me. Like, this is who I am. But most kids growing up, and teens particularly, just want to blend in. They just want to be like everyone else. So when you get picked up by your parent and your parent is speaking to you in another language, be it, Spanish or any other
Right.
language, I think teens sometimes will freeze. Like,
Right.
my like, my friends don't speak this language, and then once my parent leaves, now I'm going to get a bunch of questions, and like, oh, like, does your mom speak English too? And then it's just like, now the different spotlight is on me. And I think
Right.
we understand that, but parents have a hard time with that because it feels like a rejection of their culture and their heritage, and that's very
Right.
dishonoring in a lot of ways. So
Right. And
it
helping
is
them build the
hard.
bridge between the two of them, right? Like,
Yeah,
that's what I found a lot in therapy, is just like bringing that to the table, to bringing that
okay,
to the
yes.
buffet of topics to talk about, and like letting us be able to dine into that, right? Like,
Yeah.
and bring bridge understanding. Yeah, I love that. Um,
Hmm.
so our last few questions here that I have, I'm enjoying this so much, Dr. Amanda, is it's like, I wanted to know what led you to becoming a therapist in your field, and yeah, just kind of starting off with that.
Okay, great. Yeah, thank you. So, I really originally kind of thought, okay, I'm gonna go into the medical field because I want to help people, and that was my knowledge of how people got helped, was going to the doctor. So I looked into that. I thought, oh man, this is way too much schooling. Um, and so I didn't pursue that. But when I got to college, and I did go to a private private Christian, I can't speak, private Christian university for my undergrad. There we go. And so they didn't have, let's say, 50 majors or however many the public universities might have, like a Cal State. Sorry, that's California State. We're not in California anymore. Like maybe a UT here, or, those state schools here. But they had a handful, obviously. But the one that stood out to me that was closest to medicine and being a doctor was psychology. So I took some clinical psychology classes, and it really fit for me. And when I listened to my professors and heard about what they were doing in the field, because all my professors were also carrying a caseload of patients, and doing research and all of these great things, writing books. And I was just like, oh my goodness, there's so much you can do in this field. And I love
Yeah.
this idea that I don't have to only do one thing. Like if I'm an accountant, I'm sure accountants can do many different things too. But my lack of knowledge of accounting is, I think of an accountant as someone who like does taxes or manages books for a company.
Right.
So I just loved the idea. Sorry, all those accountants watching, that might have sounded a little disparaging. We appreciate
You,
you.
yes.
We know you have multiple talents, but
Yes.
my my world kind of opened up in terms of understanding the options that could be available to me if I pursued this field, and it fit with what I wanted to do. And as I went deeper into it, you know, more classes, more semesters or quarters or whatever it was back then, I took these like personality tests, and they do these like job things, and lo and behold, it fit like perfectly. Like, you belong in like a helping field, and you belong in working with people.
You're like,
And
heck, that's right.
yes, like conversation should be a main part of your employee or employment. So so it was really affirming and really just confirmed what I already felt inside. And then after my undergrad, I did work in social services, working with a homeless population, and I helped families transition into permanent housing. And so just really being amongst people who, you know, and this was during a time in our world in the United States that was economically crashing. Not to
Yeah.
age myself, but a lot of people who perhaps lived in a 3-bedroom home 2 weeks ago now had like their home foreclosed on and were laid off of work, and were in really dire predicaments that they had never experienced. And then I also
Yeah.
had families who were unfortunately in a cycle of where like they themselves were probably most likely homeless as a child and different things. So I just got to work with a diverse population, and that really helped me grow in my ability to relate to many different people's many different walks of life. And it really prepared me for when I went to grad school and had to consider doing therapy with not only adults but also children. And then I found my niche in working with kids, and so that was something that was also kind of inspired by some of my professors. But then once I gave it a shot, I was like, this 100% fits for me. And I just kind of have never looked back.
Yeah. Once you find it, you jump right in, right? I love that. You know, I originally, when I first started my, post high school education journey, was going to be a children's attorney, whatever that means. But I was just
Mm,
like, I'm going to be attorney for children. And lo and behold, here I am. So
there you go.
still working with kids, but in a different
Yeah.
way, right? I was going to say, so last question here is what, last two questions, and I'm just going to ask them to you together.
Okay.
What, for anyone with a background, a family background or cultural background where therapy is just not friendly, right? It wasn't part of their family system, the concept to, be able to talk to other people about your problems or work through your mental health issues. Why should someone that comes from that background, go to therapy and give it a try? And then running up to that question is the last question is, what does it mean for you to be a Latina?
Okay, thank you. So, what I'll say is, to answer the first question, is I have met and encountered a lot of people, whether it's personally, like friends, and also patients who do have families who just historically are not big promoters of mental health. And it's actually not uncommon. I think one thing we'll say is the COVID-19 pandemic did bring to light a lot of mental health issues that were just occurring for, like I kind of mentioned earlier with the housing thing, but for people who previously may not have struggled with that. But now we just have this like literal uncertain world, and it created a lot of, I guess, issues for a lot of different people. So thankfully, that has brought a lot of things to light. I feel like where mental health is more recognized and accepted in varying different cultures, but I understand that it's still not encouraged in many. So what I would say to those people who won't really find a lot of support from their family, or maybe they are a parent and their parents or their in-laws or their extended family wouldn't really support them bringing their child into therapy, is to really just, you have to go off of your own convictions as to what your heart and your mind and your soul is telling you need.
Yeah.
So if that is connecting more with your God or your spiritual sense, then go for that. If that is connecting more with your family and your friends and the community around you, go for that. And if all of those things still aren't cutting it and like still aren't getting the job done and there's still a struggle there that's just not allowing you to be 100% you or showing up in your space as authentically or as richly as you'd like to, I would encourage you to give therapy a try and
Yeah.
be like honest with the person that you're meeting with, whether it's a phone consultation or an in-person intake. Just let them know, like, never done this before and this is actually really uncomfortable, and it lets the therapist just take it at your pace,
Yeah.
because we don't want to say, okay, we've done this intake, we have treatment goals, let's get right to work.
Right.
This is a relationship, so just like any other type of relationship, we will go at whatever pace you need or you want, and we can dive in as deep as you want, or
Yeah.
when you want. So I would just encourage people that they can use the tools and the resources and the supports that they do have and that they know their culture and their family would support and encourage. And then if there's still something lingering, just give yourself that permission to take a risk and then be honest in that process with the person. And if it feels right, then you know you've made the right choice. If it still
Yeah.
feels wrong, then you can explore another option, right? Therapy is not the end all be all for everybody.
Right. I love that.
So, yeah. And then for me, what it means to be a Latina, that's an interesting question. We only have 2 minutes left, but as you can tell, I am very white looking. And so I'm like half Latina, and that's okay with me. I learned Spanish in high school. I did not grow up speaking Spanish. My family does not speak Spanish. My grandparents do or did. And they would they'd call me like, oh, mija, and, they would call me little names in Spanish, and they would be like, what was it? Arroz con pollo, and they would like talk about all the dishes in Spanish, and I didn't know that those were Spanish words per se. I just knew that I was eating arroz con pollo, right?
Right.
So once I learned how to speak Spanish, I was like, oh, okay, that's chicken and rice. Great. Love it. So I grew up partially in an environment just to respect and honor that heritage without knowing too much about it on the surface. It was just like in my heart. And then
Yeah.
as I had to seek, because I grew up in a small town, I had to seek out more information and what is this heritage. I wanted to learn Spanish, and that's partially why after only 4 years I learned it, because I really wanted to. But so for me, I do try and bring it into my daily life. I did marry someone who's also half Mexican, so I got that Mendez name. Gracias a Dios. um, so it's interesting, Victoria, because like I said, on the surface, there is a lot of imposter syndrome when it comes to saying I'm a Latina. Like, I do feel like, am I doing my heritage, the honor that it deserves? And I'm like, yes, because I
Yes,
just have to be true to
absolutely.
myself. So
Yeah.
I actually have learned to take pride in the fact that I don't need to look a certain way to be who I am, and I don't have to make anyone else believe me but myself. So for me, it's just been a journey of learning the culture as much as I can, because I felt it in my heart, but I didn't have it surrounding me as much as someone else might have. And so
Yeah.
really stepping into that and owning it. And then that's why I am very passionate about working with Latina families or Latinx families, because I want to respect their culture and I want to learn about them and let them know that, sí, yo hablo español, but like I am not you and you are not me, and that's okay.
Right.
So let's learn. Let's walk with each other, let's embrace our differences and just really empower you where you're at, where you want to go.
I love that so much. Well, thank you so much, Dr. Amanda, for being on this interview. I appreciate it. And everyone, you can find her in Nashville. I have all your contact information on how to seek you out
Thank
for
you.
therapy, and that will be posted on there, and they'll be able to contact you. So thank you so much, and I will
Thank
see you
you.
soon. Like,
See you
bye.
soon. Bye.
Bye.